coronavirus and your mental health and how to cope. Imagine without coronavirus, how would your life be? How would the world look like? Surprisingly, we've coped with isolation through regular video calls with our friends and family members and developed a quarantine routine to structure our days, living alone in an apartment and going outside only when we need to buy supplies. I think anxiety is growing, especially among the younger generation. It makes sense because we are the future and we will bear the consequences of problems like climate change the most. The elderly people aren't going to see the worst consequences of climate change. Younger people and their kids will. I think all fear or anxiety don't have boundary. Climate change is already anxiety provoking enough, but that's a longer time scale and border. Then with coronavirus, the pandemic-like virus is just feeding our existing anxiety. Things have changed dramatically since the 1990s. One big change is technology. What we hope to understand is how the internet and social media plays a role in helping people cope with stressful events. But on the other hand, people may consume too much negative information online during an epidemic, and that might also have negative health effects. We don't know how much about the coronavirus that really contributes to anxiety, because we don't know who has it, how long the incubation is exactly, and there's no vaccine. So it's kind of terrifying to follow the sharp increase in number of people who have the disease and the number of deaths in different countries. This information is dreadful. At the same time, it captures our attention so well. We are glued to the news about coronavirus, which is rational to some degree because we have to be careful with the virus. There are many reasons, and main one is globalization. Since the SARS outbreak in 2003, there's been way more international travel. What's worrying with the coronavirus is that people can have no symptoms for a long time but can still spread the disease. The world is so connected that you can be anywhere and not have traveled and still get sick. This can make people extra anxious. Globalization means diseases can quickly turn into a pandemic. What can people do to manage anxiety, avoid panicking about coronavirus, and maintain their mental health? The best ways to counteract anxiety is to actually adopt the regular health and hygiene behaviors that are more effective than we think. For instance, washing our hands with soap for 20 seconds regularly, that's very effective, way more than wearing a face mask. Organizations are putting out tips on what each person can do, engaging in those behaviors, covering your mouth when you sneeze or cough. Those behaviors not only play a big role towards stopping the spread of the germs in general, they can also help alleviate anxiety. Here I am in Shenyang Medical College, still on the route to my future goals, currently in period of global pandemic, this COVID-19. I do a lot of things to keep me sane because I care so much about my mental health in this period of compulsory lockdown. I try as much as possible to talk to at least 5 of my friends a day to keep me happy and focused. I know for sure that very soon everything will be back to normal, and because that's what we humans do, right? We always bounce back. I want to give a big shout out to the doctors and every public workers out there, and thanks to our teachers and our guidance who are helping us in this hard situation. And I encourage everybody, especially my fellow students, to continue pushing hard, because if we stop pushing hard towards our dreams, then after the global pandemic, what next? Ask yourself. I am Bakshore Ipotari. I'm from Nigeria. I'm a student of Shenyang Medical College 2017 batch.